A1.
This patient has wide nasal ala. In this case, Alar resection and nasal tip plasty are usually performed simultaneously. If nasal tip is projected, nasal ala looks narrower by optical illusion, and actually it becomes narrower a little bit. This is the immediate postoperative view. Nasal tip is projected, and nasal ala is narrowed by resecting skin under the nose. You are watching how to do the surgical design. Triangular shape of skin should be remained, and this is very important. Because of this remained triangular shape of skin, subnasal depression can be prevented and nostril shape becomes natural. The area marked with red will be removed only, and suture is performed in Y shape as in the picture. As you see, the only skin under the nose should be resected, and bear in mind that the resection must not be extended to the exterior ala. This is the post-operative view. After ala resection, nasal ala doesn't look that narrow in frontal view, but the effect of ala resection is definitely noticeable in worm's eye view. There are some points to consider when performing ala resection within the person with broad nasal ala. I continuously say that the resection should not be made out to the nasal ala since the scar can be remained a lot. Second, nasal tip plasty and ala resection are performed simultaneously in most cases, especially if nasal tip is low. Only with the nasal tip projection, nasal ala can be narrowed or look narrower by optical illusion. Third, there can be not much difference in the frontal view, but certainly narrowed nasal ala can be seen in the worm's eye view. Fourth, this is very important point. Even with the broad nasal ala, if the size of nostril is normal or small, ala resection should not be performed because the person can suffer from the functional problem such that nasal obstruction occurs and breathing can be difficult due to the small nostrils. For these people, only nasal tip plasty must be performed. As I talked earlier, nasal ala can be looked narrower only with the nasal tip plasty. These pictures are pre- and post-operative views after ala resection and nasal tip plasty. This is another case of having tip plasty and ala resection together. This patient has bigger nostrils than normal size. In this case, the surgical result is gratifier than others when having ala resection. This patient used to have very widely spreaded nostrils. This is also the case of having tip plasty and ala resection. As seen in those several cases, the shape of nostrils is natural, nasal tip is nicely projected, and the scar at incision site is unseen after the surgery. I will explain once more about the method of ala resection for wide nasal ala and the points to be cautious. When resecting skin for wide nasal ala, the skin right under the nose should be removed only as marked. If the resection is extended to the side, like the line marked for over resection, scar will be remained a lot and nasal ala shape turns unnatural. Procedure. This is pre-operational design. If the resection site is extended outward, severe scar is possibly remained. Therefore, the resection area must be limited under the nose as much as possible. You're watching the resection procedure of skin under the nose. To prevent the skin depression and deformation and minimize the scar, Leave the skin in triangular shape and insert this triangular skin flap into the resected area. Nostril shape is also naturally created. Side effects of Alar resection in other clinics. The biggest issues in the Alar resection are the scar under the nose and outside the nasal ala. Since the resected area under the nose is depressed, this should be the problem, and pocketed scars are remained in several spots along the exterior nasal ala because of the sebaceous gland. Therefore, the extended resection should be prohibited for preventing those issues. Thank you very much.